2, 1.
Bismillahirrahmanirrahim. Assalamu alaikum and a very good evening.
This is where the battle against vaccine disinformation is being fought, community by community. This British Muslim TV network in East London's aired debates tackling some of the many myths that have taken root around the pandemic.
Whatever the myths, whatever the false information out there that is not correct, we all need to, obviously we are British Muslims, we are part of the society, we need to make sure we get our vaccine done.
In a recent British survey, 42% of respondents from Bangladeshi and Pakistani communities said that they were unlikely or very unlikely to be vaccinated. And that figure rises to 72% of black and black British people, meaning those people who are most at risk of contracting COVID-19 and ending up in hospital or even dying of the virus are now least likely to be vaccinated. It's a growing concern for the British government that wants to offer a first dose to every adult in the country by September.
If the adult population of the rest of the country is vaccinated, the virus will look for a place for it to infect, a human for it to infect. And if it infects particular communities because they happen to be unvaccinated, it will absolutely go through them like a fire and will be hugely damaging.
While the whole world is searching for a vaccine.
This is one of many fake news items distorting people's understanding of the virus and the vaccines. It claims inhaling steam kills the virus.
This vaccine is poison. This vaccine is going to change your DNA.
Wild conspiracy theories are deepening public distrust in medical science, leading to an angry protest by this man outside a Muslim community centre offering COVID jabs.
With Muslims or South Asians, it can be whether there's alcohol in the vaccine, whether there's any animal ingredients in the vaccine, specifically pork products, which is of interest to the Muslim community. And then there's other types of myths which are peddled. For example, coronavirus is spread via the 5G network, or the vaccine can cause infertility, or it can fundamentally change your DNA. Of course, I'd like to point out all of these are false. There's no truth in any of them.
There's a sense of unease among some black Londoners. Many are keen to be vaccinated, but one man told us he thought there might be different vaccines for black and white people.
We're scared because these days you don't know who to trust.
COVID hesitancy also extends to ultra-Orthodox Jewish communities, again over fears the vaccine contains pork, or as this controversial Israeli rabbi popular on YouTube suggested, over fears it alters people's sexual orientation. Conspiracy theories exploit a lack of trust in the government and a health system that for some ethnic minorities appears to favour white people and the more affluent. The challenge now lies in building trust in vaccines proven to protect us all. Neave Barker, Al Jazeera, London.